Now we have Josh Smith, senior correspondent at Reuters, joining us live from the South Korean capital of Seoul. Josh, thank you so much for being with us here on the broadcast on WION World is One. Talk to us now. South Korea has officially confirmed that it is indeed in the middle of a second wave of COVID-19.
That is correct, though officials here have also explained that they don't see this as a second wave in the same way that WHO may talk about a second wave for the world. The scope here is much smaller, but they do say now that they see quite a distinct kind of difference between the current wave of infections that they're seeing now and the first massive wave that you mentioned that happened in late February and into March. That first wave was traced mostly to church and some religious gatherings here. They see this second wave, which is mostly focused in Seoul, as having started around the time of a holiday in early May. And these are kind of distinct infections that have now spread more in the Seoul area. And that's something that they're tracking very closely now.
And as part of that, have restrictions been reinforced in the capital, Seoul?
Here and there, after the infections were seen at some nightclubs and bars, then venues like that were required to take some extra steps, and in some cases were required to close for a time period. That being said, I think that right now authorities are raising concerns about the second wave precisely because they don't want to have to reimpose some stricter measures. A lot of the statements that are coming out right now are noting that overall domestic cases here continue to be in kind of the low double digits, which is for them a manageable number. But they are worried that any one of those cases could lead to a wider outbreak. And so they're really encouraging people to continue to maintain some daily social distancing, wear masks, things like that, in the hopes of not being required to go back to more of the strict social distancing.
Right, Josh. South Korea was considered a success story when it comes to fighting the pandemic. Its intensive contact tracing mechanism has been hailed globally and was one of the first countries to start returning back to normalcy. How do you see that process being affected due to this new emergence of COVID-19 cases?
So far, authorities have said that the current rate of infections is manageable. They are managing to trace and track and treat those cases. And so far, they have continued that strategy. So far, they've also not rolled back plans, for example, of opening schools. Most schools have now reopened, and most businesses and things like that are also operating somewhat normally. That being said, they have also said that this is going to be a long, protracted fight, and that people are going to need to take daily preventive measures for a long time to come. And so I think a lot of this is to try to remind people that, even if they have this strategy of tracing people and tracking them down, that's not a substitute for people taking their own preventive measures to try to avoid being infected in the first place or spreading it to others.